Hello and welcome to my channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. Today I'm talking about the benefits of and if you are an ideal candidate for a facelift. So stay tuned to find out everything you need to know. And don't forget to hit that subscribe button and like below. Let's get going. All right, so here we go with the topic of the day, if a facelift is right for you. Now, over time, the facial tissues lose volume and move downward, creating a tired, wrinkled, and aged appearance. Then the skin becomes less elastic, fat deposits appear, and the underlying musculature loses tone, resulting in jowl formation at the cheeks and jawline, deepening of the nasolabial folds, and loss of a defined neckline. A facelift is the gold standard for long-term facial rejuvenation. It is a surgical procedure that utilizes a series of well-hidden incisions to improve visible signs of aging and redefine the contours of the lower face and neckline, ultimately providing results that last for decades. I mean, can you believe it? A single procedure can tighten loose or lax skin, smooth away wrinkles, remove excess fat and muscle banding, eliminate a double chin, address jowling, and redefine the youthful contours of the face and neck. Sounds like a no-brainer, right? Well, to achieve satisfactory results, there are 3 things I look at and determine prior to deciding whether or not you are an ideal candidate for a facelift. So let's get started with that. Number 1, physical features. When assessing your anatomy, you'll generally fall into one of 3 types of candidates. Type 1, these patients present with mild to moderate laxity in the jowls and neck, but really no fat and very minimal muscle banding. While age is not a factor in determining this categorization, type 1 clients are often younger and have early signs of aging. Type 2, this is the most common category. These patients present with moderate laxity of the jowls and neck and have definitive accumulation of fat with apparent muscle banding. And then finally, there's type 3. These patients have a heavy neck with significant skin laxity, excess fat accumulation, muscle banding, and a poorly defined chin, jaw, and neckline. In addition, men typically tend to fall into this category secondary to their thick skin and prominence of hair follicles. Number 2, social attributes. Now, I can easily give you a blanket statement saying the ideal candidate for a facelift is a non-smoking, realistic individual without medical conditions that impair healing. While this sounds pretty self-explanatory, there are a few conditions to be aware of when determining if a patient is an ideal candidate for a facelift. Number 1, smoking is a no-no. Current use of tobacco and nicotine products, including but not limited to cigarettes, vaping, patches, and gum, can result in extremely poor wound healing during the healing process. Number 2, medical conditions such as collagen vascular diseases, certain autoimmune conditions, uncontrolled diabetes, and a prior history of head and neck radiation are also contraindicated due to poor wound healing and a higher risk of complications. And obesity. While obesity is not a definitive contraindication for qualifying for a facelift procedure, there are a few things to keep in mind. For starters, those actively dieting will not qualify for a facelift until they are at a stable weight. In addition, those with heavier necks and faces do not achieve a crisp result compared to others, and some will need a revision procedure in the future as well. And number 3, mental awareness. Mental health and stability are huge factors in determining facelift candidacy. It's important for me to understand why a patient is seeking to change his or her physical appearance in order to determine if he or she qualifies for a procedure. Those with unrealistic expectations of surgery, those having been under pressure by a relative or significant other, those who are struggling with their mental emotional health, and those who believe a procedure will solve a failing aspect of their life do not qualify for this procedure. Now, if this procedure interests you, I encourage you to watch my other videos on why the face and neck ages, treatment options, and recovery. As always, we know that personal transformation is one of life's most meaningful journeys, and Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.